Well, hello, everyone. Hello, everyone. It's your girl, Gabrielle. Welcome to a brand new episode of Hot Topics. If you are new to the podcast or if you are returning to the show, I'm just going to tell you what this show is about. So, this is the show where I like to bring guests on to talk about a lot of the quote unquote hot topics, popular topics that are out there. Uh, Topics that tend to be in education, mental health, physical health, science, anything like that, all for the purpose of education and all for the purpose of teaching you something. And today is no different. I am looking forward to this show. For this episode, I should say, because I'm looking forward to this particular topic. I'm curious to see where this is going to go. So, the topic of this episode is pap smears. That's right. Ladies, if you're watching, listening, or guys, if you want to learn more about women's health, this while we are in March, this is Women's History Month. So what a appropriate time to talk about pap smears and what all that is about. So I have a guest who is going to help me with this topic. She is actually a returning guest, and her name is Dr. Jasmine Ebott. And I'm just going to tell you briefly about who she is. So, Dr. Jasmine Ebott, she is a GYN gynecology fellow, and she is on a mission to shatter medical gatekeeping one video at a time. Beautiful, beautiful, beautiful. All right, so without further ado, I'm going to go ahead and bring Dr. Ebott to the stage. Hi there. How are you doing
Hello.
today?
Good. How are you?
Good, good, good. All right, so we are here in Women's History Month. You are back on the hot seats. We are here to talk about pap smears.
Yeah.
So let's jump right into it. So, what is it? What is a
Yeah.
pap smear?
Yeah. First off, I want to say sorry. I'm a tad under the weather, but gonna push through. And so if I have to pause and cough, I'll mute myself so we don't have that on the podcast too much. But I wanted to first off and say that I'm a GYN oncologist, which is really confusing, I think, and we don't talk about it enough. So, when you would see me for the most part is if you developed cancer of one of the female organs, or anyone who has female organs but identifies maybe differently. And so, you won't hopefully have to see me, but if you do see me, then that means that we're kind of probably talking about some type of pre-cancer lesion or cancer lesion. And then I also just wanted to clarify, as a fellow, that means that I'm at the end of my training, and it can be kind of confusing because you hear about medical students and then residents and then fellows. And fellows kind of like the last step of apprenticeship before you're let off to practice on your own. Um, and so that's sort of an aside. But what is a pap smear? So a pap smear, you'll also hear us talk about HPV screening. It's basically a way for us to look at the cervix cells. So all of our body has cells all over. We're just completely composed of millions, billions of cells. And the cervix is just the bottom part of the uterus. And I've been meaning to like buy myself a diagram for my future podcasts and things like that. But the bottom part of the uterus. So it's not really separate. People are like, oh, where's my cervix? Like it's the uterus, and then the bottom part is the cervix. And you can look at a diagram on Google. And we will look at it and we will take cells from that and look at those. Well, I won't look at them under the microscope. A pathologist or a cytopathologist. So, two separate doctors are taking care of you, one of whom you'll never meet, and either me or a OBGYN or a family planning doctor, or sorry, a family practice doctor are taking care of you. So you'll get your pap smear, and then someone will look at those cells under the microscope and tell you if it's normal, abnormal, or cancer. Hopefully that makes sense. Kind of.
Yes, thank you. Thank you so much for that. So now, how how does it work? How does
Yeah.
take us through the process?
So you would come to, like I said, many different doctors can perform a pap smear, not just an OBGYN. So you would go to whoever your doctor is doing your well woman checkups, and they will place a speculum. And so I think people get really confused about if they've had a speculum. A speculum is a metal device that goes into the vagina and opens up so that you can see the cervix. But just because you have a speculum placed doesn't mean that you are having a pap smear. And I think that women who I'll see them for their appointments, and they will tell me that they've had a pap smear and they were in the ED and they got a pap smear. I'm like, you did not get a pap smear. Like, you got a speculum placed in your vagina during your ED visit, but there is no way that an ER, I use ED as emergency department, but the ER, I think, is what most people think of it still. Um, you are not getting a pap smear in the emergency room or your urgent care, because there's no way that those doctors are going to have any way to follow up on it. So just because someone uses a speculum to look at your cervix does not mean that you got a pap smear. So you get a speculum placed, and then there's these special brushes that we use that we brush along the cervix. I tell people it's literally like a donut. It looks like a donut. We brush on the outside of the donut, and if you can think of a donut hole, on the inside of the donut hole too, so that we can get all of the cells on the outside and the inside of the donut. And that is a pap smear. And if your cervix did not get brushed with those brushes that we have in the office, then you did not get a pap smear.
So it's so how often are I mean well, how do I phrase it? Is it, should women be required to get it, or is it how often, let me put it to you this way.
Yeah.
How often should women get it, if at all?
Yeah, that's a great question. Um, you should start at the age of 21, and you should have it every 3 years until you're 30. And when you're 30, we start screening for HPV, and then it's every 5 years as long as it's normal up until the age of 61. And I'm going to actually throw a question back at you, Gabrielle, just because I'm curious. Did you feel like you understood that difference in when you were in your 20s, the difference between like getting a speculum exam and a pap smear, even though you're like very highly educated, things like
Um,
that?
I think um I think I've had different experiences when I had my pap smears. I guess mainly because I went to different doctors, but some doctors like used, sorry, something just popped up here. I just wanted to show that if you don't hit the smear, you don't get sick. I don't know if that makes sense to you.
No.
Well, if you could elaborate on that, Teos, what that means. But yes, so I went to pretty much different doctors, but like some doctors use this. Well, I think the one that the male doctor I went to used a speculum, but he used a speculum, um, and then the female one tended to not use it. They
Hmm.
just kind of jabbed it in there. But in terms of the difference between the two, I guess I never experienced something else other than a pap smear. I don't know
Yeah.
if that answers your question, but
Yeah, that
I
makes
had
sense.
different experiences. Like some used the
Yeah.
speculums and some didn't.
Okay. That's helpful to know.
Yeah.
Um, but yeah, so I think there's also confusion of whether or not like the when you start. So again, it's age 21. And some people will say, well, if you haven't been sexually active, like maybe you, excuse me, I'm going to mute for a second.
It's okay.
Maybe you shouldn't get it. But I think that the guidelines are there for a reason. We're trying not to miss people. And so just blanket statement is that at the age of 21, that's when you should start. And it's every 3 years until you're 30. And then it moves to every 5.
That's
Um,
if you're not sexually active.
that's everyone.
Everyone,
Everyone.
period. Okay.
Everyone's starting at age 21 and then at age 30 moving to 5 years. And the reason why we moved to 5 years is because starting at age 30 we start to screen for HPV. So between 21 and 30 years old, we're just looking at the cells under the microscope. We're not looking at for that HPV virus, because we know that the women who are between 21 and 30, that they are healthy enough to clear the virus, and that they should be able to clear it. And so we're not looking for it because we think that basically you're going to clear it with your healthy immune system. And then starting at 30, we know that people's immune systems just aren't as robust. And so we start screening for HPV and we see what the HPV status is. And so that's the reason why. So if someone is negative for HPV at 30, then they get to be on the 5-year training, because we know that likely they won't get cervical cancer or precancer.
So if so so what about the visits every 6 months to a year to a gynecologist? What is that?
Yeah.
Because I thought that was the pap smears, but is that something else?
No, yeah. So we say still to go every year, because like any other like organ system, like it's good for someone to take a look. There's the outside lips, the vulva, the vagina itself, and then also just checking to make sure that we're not missing anything. So they're doing. That's why I was asking you if you knew, kind of felt like you knew the difference, because what I notice a lot is that women don't understand that if you're going every year and you're doing a good job of going every year, you might get a speculum place, and someone might be just taking a look at your cervix, making sure it like visually looks healthy, but they're not doing a pap smear. So I see women all the time in my office, and I place the speculum, I take a look at their cervix, but I'm not doing a pap smear. And every time I do that, I always say that I'm not doing a pap smear so that they're not confused. But I know that not all doctors do that.
Oh, so basically the pap smear is the
The
speculum in the vagina, but then there's a brush and you scrape across the cervix. So when you're scraping across the cervix, as I'm guessing you're scraping off some of the cells
correct,
and
yeah.
that, and then you pull it out. Okay.
Yeah. So if you're going every year, like you should, you still might get a speculum exam depending on your provider's practice, but that doesn't mean that they're doing a pap smear, and that's okay. You don't need one every year, but people will take a look just to make sure things look healthy. Just like someone takes a look in your mouth or listens to your heart and your lungs, like there are all these cells that can go rogue, and the screening tests are not perfect, right? They're screening tests for a reason. Like they can miss things. So like by me taking a look once a year, if I see something that looks abnormal, that will prompt me to do a test. Um, and so I think it's important to know the difference. Does that make sense?
I think so.
Sorry, it's
So
hard to explain.
it can be confusing. Um, so pap smears only test for HPV. Is that what you're saying?
Cervi- and cervical cancer.
HPV and cervical cancer. Okay, and
Hmm.
why those two in particular? That the pap smear focus on. Like, there's nothing else. There's no other
Just
diseases that's important for a
it's
test.
just it's just what's been developed. It's kind of like what the science, what we have, that's what's been developed. So there were just, it's not that someone doesn't want it to test for something else. It's kind of like a colonoscopy. It was just developed for screening the colon. So it's it's a screening test specifically for that, and that's what we have. Um, it's other things are important, I guess. It's just that's what we have, and that's what it's was designed for.
So,
Um, yeah.
so just to reiterate, so basically you should do the pass. Well, you said 21. Why 21? Why not before 21?
Yeah, so they found even more so when you were young, when you're younger, that your immune system is really, really robust, and so your ability to clear any HPV, excuse me, abnormal cells is just really high. And we found that we were just like causing young women more procedures than they needed when you're starting that young. And it's a pretty invasive test. Some people aren't even sexually active by that time. And so they moved it to 21 to kind of cut down on the invasiveness that is, you know, being caused to younger women. Excuse
So
me.
basically, you're saying so starting from 21, every 3 years up to 30, and
And
then
then every,
after 30 is every 5 years.
correct.
So then why
Up
stop
until the
at 30?
up until the age of 65. Sorry.
So, okay, every 3 years up to 30 years old, and then every 5 years after that until 65.
Yep. As long as it's been normal.
So let's talk about when it's not normal. So
Yeah.
someone who has HPV. Well, I guess
Yeah.
we'll talk about it separately. So you discover someone has HPV, which I probably should say it stands for it's papilloma,
Papillomavirus.
human
Yep.
papillomavirus. Okay. So, okay, so let's talk about worst case. You discover your patient has HPV. Where do you go from there?
Yeah, so that's I knew this was going to come up. It's a really complicated question because we stratify everything by age. So I will probably steer us away from getting into like the exact nitty gritty because for you and I in our 30s, it'll be different than for someone who's in their 20s, and it'll be different for someone who's in their 50s. And so we actually can't even like keep it in our brains. We've developed an app that almost all GYN doctors utilize to take us through these algorithms. And I even actually pull it up and show the patient with me and punch in all of their information and show them how we get to the decision making process. But I can give you sort of broad strokes. I think is probably the best way instead of saying, if someone has HPV. So one of the things that I will say is, let's say someone has the form of pre-cancer that is right before cancer. So we call that CIN, CIN1, CIN2, and CIN3. If someone has CIN3, they either need a LEAP, which is basically an excisional procedure of their cervix, or a cone, same thing. And if they really don't want to do that, then I need to repeat a pap smear in 6 months. And that's probably the better thing to talk about is like the very step before cancer, because that makes everyone sort of fall into the same category. Uh, I know it can be quite confusing, but HPV um, doesn't necessarily mean that you're going to have a next step other than getting a pap smear repeated in a year, depending on your age. Sorry.
So I
It's,
I guess I I guess I do want to try to
yeah,
pick at that a little bit more.
yeah.
So so you're saying there's levels. So you find out someone has HPV, you retest it just to double check, and then the results are consistent. They do have it. Are you saying there's another step before cancer?
So I'm saying, maybe this is the better way to say it. So HPV is the virus, but the virus can be around and not cause any problems. So maybe I'll backtrack. So you can think about it like having the flu and not being symptomatic. So let's say you got COVID or the flu, but you feel fine, right? You took that test and you have no issues. So you can think of HPV like that. So you can have HPV and you can have normal cervical cells. So meaning that you are carrying it and it's not like bothering you at all. Um, Ali Wong does this like really funny reenactment about like how everyone has HPV. So just because you have HPV doesn't mean you actually really have a problem, other than that you have it. The the problem is when the cells become abnormal because of the virus. And so that's why I was saying it doesn't exactly matter if you have it or not. It matters if, and that's why we stopped testing those young girls, because so many people have it. But when you're young and healthy, you get the flu, you can clear the flu. But if you're 68 and you get the flu, like you might be on a ventilator. So it's kind of like that same concept. You have HPV, it might not matter, but you get, the older we get, you get HPV and it might matter a little bit more. Or if you have HPV and it is a really like virulent, meaning really strong strain, then it might matter and it might cause cancer. And so that's sort of probably where I should have started. If does that make more sense?
Right. So just you, even though you detect HPV, it doesn't necessarily mean you're showing symptoms. You might just have it.
Yeah.
So now, so is there any extra testing? So even someone is not showing symptoms, is
Yeah.
there, do you test more often, or is the same schedule?
It just all depends on what those cells look like under the under the microscope for the cervix. So you often end up needing some extra testing. Usually maybe every year, but again, how it works and what it means for you is dependent on your age. And so sometimes it means that you get a pap smear again in a year. Sometimes, depending on your age, it means that you get a colposcopy. Um, and so it sort of is very much dependent on your age, the virus, and what your last pap smear was even. So it gets quite um, almost like very much precision medicine, if you would say, that each person sort of ends up having something different.
So you observe the cells under the, so depending on the age, you
Hmm.
observe the cells under the microscope. And so now let's say the person, you detect that the person has cervical cancer
Hmm. Or pre-cancer,
or
probably.
precancer.
Yeah,
What happens then? Is that when you start to refer them for,
a
um,
procedure. Yeah. That's so. I think that's probably what I was getting at. Is like the pre-cancer is probably where the broadness of if then narrows, and so you have pre-cancer, meaning CIN 2 or 3, and I keep saying CIN, but it's cervical intraepithelial neoplasia, and that's a really mouthful to say pre-cancer of the cervix, and that is the step before cancer. So you can be 1, which is not so bad, 2, which is in the middle, and 3, which is like the step before cancer. Um, and 2 and 3 are the ones that need some really close follow up. That means that if you have CIN 3, like the step before cancer, we probably need to do a cone or a leap, which means taking off some of the top of your cervix. Um, and
taking off some of the cervix?
mhm.
As in like cutting down the skin?
Yeah, cutting the donut. So if this was the donut, I'm trying to make we would literally cut some of the donut off. So we'd cut through the top part of the cervix. And the cervix kind of reheals and it can be do just fine afterwards. Uh,
So then
yeah.
after that, is it safe to say the person is in remission, cancer free?
No. So then you get a pap smear again in 6 months to check to see where you're at. And then if that one's okay, usually it's like another 6 months. And then if that one's okay, then you get moved out to like a year. And there's obviously even more if then factors based off of each result of the pap smear that you have after that procedure. Um,
Oh, okay. So
yeah.
there's a lot that goes into Pap smears.
There's a lot that goes into it. I think like what I have seen way too often is women just like ignoring the fact that they need one. And like as long as you're plugged into someone who is staying up to date with the guidelines, that's probably the most important thing so that you like people don't have to memorize what I don't even have it all memorized because it's so nuanced.
Mhm.
But the most important thing is knowing that you need to stay on top of them. Yeah.
So when they say go to your gynecologist every 6 months to a year,
hmm
I guess in my mind it was always a pap smear. But now you're saying that may not necessarily be. It might just be other things.
Yeah. So, like, a mammogram is coming up for us at age 40. Um, and also, like, a gynecologist. Sometimes people don't have a primary care doctor, but it's easier to get into a gynecologist. So some of them feel comfortable making sure that, like, your cholesterol is fine and that your lipids are fine. Some of them will even do diabetes screening. Um, and then if there's not that much, you can talk about your periods. There's a whole host of other things. I mean, people get itchy down in the vulva area, so it kind of just allows you to have a quick check-in. And typically, we say every year. I would say 6 months is a little bit more frequently, unless you have some type of, true issue going on. But yeah, every year would be sufficient. And then if you need more frequent visits, they'll let you know. Excuse me.
So are there certain type of patients that should get a pap smear? Like, is it certain demographics, certain people? Like, is there anyone that should get a pap smear as
Yeah.
opposed to someone else?
Yeah, definitely. So anyone with HIV or who's immunosuppressed, and I think we throw around immunosuppression a lot in America. When we talk about immunosuppression, I mean, that's someone who's a transplant patient who's like on drugs that keep their immune system truly suppressed so that they don't reject whatever organ they got, or someone who has lupus but is actually taking medication for the lupus. Or someone with some type of like rheumatoid arthritis, but they are actually taking immune medications for rheumatoid arthritis. So it's not just like, oh, I have those conditions, but like, no, my condition is so bad that I am taking immunosuppressive medication, and you would know that you are on those medications. They're not like small types of medication. So anyone who's got HIV, because those people are on heavy immunosuppressive drugs, and any of other reasons to be on heavy duty immunosuppressive drugs, those patients need pap smears every year typically. If they've really had normal pap smears, then they can be moved out to 3 years, but that's definitely a conversation to have with your GYN doctor. So those are the people who should have pap smears and should be getting everything checked. Otherwise, there's not really any demographic difference. So black, white, Hispanic, Asian, um, everyone kind of is in the same boat. Our cervixes basically look the same. Like I look at a cervix, a pink, they're all pink, no matter what your color is on the outside. So they're all get affected by HPV vaccine, the virus the same.
So I just wanted to go back to what you said earlier
Yeah.
um about sexual activity and that it doesn't
Mhm.
really matter how often you get it. Um, is it not safe to assume that women who are sexually active should be checked more often?
Yeah, if just because you're sexually active doesn't mean that you should be checked more often. It just means that we know that women who are really highly like sexually active, they have probably a higher chance of contracting HPV, right? Like you are more out there being exposed to it, so you have a higher chance of contracting HPV. Maybe there's a higher association with having HPV that then leads to cervix cancer. But we won't screen just because someone has 10 partners in 1 year and someone has one partner in 1 year. That's not going to push me to do the HPV screening or the pap smear anymore frequently. It's the result of those two, right? One partner, and maybe the partner you slept with has like all the HPV viruses, and then somehow the person who's sleeping with 10 people got lucky, and those partners didn't really have HPV. So it's really just what is the result of that pap smear afterwards.
Okay.
Yeah.
And then
It's
go
I was
ahead.
gonna say it's not to say that like being because we also I don't also want to like sex shame anyone. Like people should have fun. It's not to say that having more frequent sex isn't a risk factor, but it's a risk factor for lots of things. So it's like if you're gonna be having more frequent sex, you're at risk for other STIs too. So yeah.
And just to go back to the age thing. So like I know like when you're older, your immune system tends to slow down. So so your pap so the pap smears, it's like you're checking less frequently as you get older.
That's a great point. Yeah. It's just the difference is that when we're checking less at that 30 mark, that's when we're checking with HPV. So between 21 and 30, we aren't looking for the virus. So we're not doing like a flu test. From between 21 and 30, we're just scraping the cells and sending them off to the lab. Starting at 30, we start checking for the virus because we think that before 30, you can clear the virus a lot easier. And so that's the difference. Some people would argue that the 5 years feels too long, but we don't have evidence to say yet that that's the truth. Um, but the difference is what we're checking, and that's how we justify moving out to 5 years. I don't know if that makes sense.
Well, you said what you're checking, because to me, I'm like, okay, 5 years does seem kind of long.
Yeah.
So,
Yeah. So at 30, I'm checking for the HPV virus and I'm checking the cells. And if both are normal, then my like predictiveness of getting cervical cancer is super low. Because now I said the cells are normal and you don't have the virus, then you're like very unlikely to get cervical cancer. So bye bye. I'll see you in 5 years. Um, and that's how you get on the 5 year train. But if you didn't meet that criteria, you're not going to get on the 5 year train. Is probably the better way to say it.
I'm just saying, what if you get it within that third year? You're still waiting 2 more years. That
Yeah,
that can be kind of dangerous.
yeah. It's hard to like speak against like a huge body of physicians, but I think we in the background as physicians kind of have those conversations too. I think that's why I say that it's really important to talk with your doctor, have them look at your cervix still. Um, and some doctors do it more frequently than that. So just having a conversation, like telling your doctor, hey, I have a new sexual partner. Like, I'm a little uncomfortable waiting 5 years. Can we do a pap smear, excuse me, at 3 years? Most people are pretty reasonable talking through that, but it does put the onus on the patient because, especially if you're moving around, getting different doctors, it's not like we talk to one another from patient to patient. So, yeah, it feels strange. I do admit that.
Mm. It's interesting how science works,
Hmm.
how it works. So,
Yeah.
so now, what? So what is the? I guess I got to think of my question now.
Yeah.
So, in terms of in terms of how important, let me put it like this:
Yeah.
how important is a pap smear?
To me, I'm very biased. I think it's very important for women. I just think that I recently posted about Jessica Petway, who passed from cervical cancer. Was a beauty influencer. I just think that it's important because it shouldn't be what someone dies of. We're really fortunate in the U.S. to not need to die of cervical cancer. And so it's super important because it's a very preventable cancer. There's plenty of other cancers that we can get, but this is the one that we should be able to help almost 99.9% of women avoid. So to me, it's like low hanging fruit, if you will. Does that
Right,
makes sense.
because it's preventable
It's
if
so
they
preventable.
you know.
It's not going to test for uterine cancer. It's not going to test for ovary cancer. It was designed just to test for cervical cancer, but it's a screening test that's a wonderful thing that has been developed, and we haven't found those tests for all the different types of cancers that we can get, GYN, non-GYN, but we've got pap smears for women and we have mammograms. Those are like the two low-hanging fruit. Get your mammograms, get your pap smears, and then at least we can hopefully prevent those two for women. Uh, it's not foolproof, obviously, but
Yeah.
yeah.
And that's important to know,
Yeah.
and it's important for women to take care of their health,
Yeah.
especially down there, especially the vagina.
Yeah.
We got to take care of our vaginas.
Yeah. I would say the other thing is the HPV vaccine. We both grew up in a time where it had just came out. And so like I actually didn't get vaccinated for HPV until this year. Um and many women who are 30, between 30 and 40 might never excuse me, might never have had the HPV vaccine, but now it's pretty common. Like in the state of Rhode Island, I think it's mandatory that you get vaccinated for HPV because it has really dropped the incidence of getting cancer of the cervix. So it's a three, if you're getting it as at the appropriate age, between 9 years old, which obviously probably none of our viewers are that age, but maybe they have kids. So between 9 years old to I think it's either 11 or 15 years old. Sorry, I'm not a pediatrician, so I don't have to like give this vaccine at that age. But as an adolescent, you're getting that vaccine and you get two of those. And then starting at 15, it's a 3 shot. But who I see are the people who are like our age who may not have gotten the vaccine, and I'm giving them a 3 dose vaccine series for to prevent the most aggressive types of HPV viruses. Is probably the best way to put it. It doesn't prevent all there's like thousands. It focuses on the 9 most aggressive ones. So
The,
if you
the
haven't
nine most
gotten
aggressive.
strains of the virus, so just like the flu, and you know how like the flu shot, they're like, oh, we developed this flu vaccine for like this XYZ strain. It's the same thing. We have a vaccine that's only specific to 9 the most virulent strains of HPV, but that there are other HPV viruses out there. And
That's
you can get that up to age 45 now. That was just approved like a few years ago. So if you are listening and you are not yet 45, insurance will cover it still. And it's a 3 series at 0, I think 0, 3, and 6 months. I always have to look it up before I give it to someone. So yeah,
that's good to know. That's good to know.
yeah,
Definitely public not well, not public knowledge, but thank you
yeah.
for sharing it, and it's
And
important
and
for
a
women.
lot of people our age don't know if they got vaccinated because it came out right when we were like 9 and 12, between 9 and 15. So like I'll ask people in their 30s if they got it, and it's hard for them to remember. But if I see someone who's in their 20s, they actually do know that they got it. So it's really interesting to see the like generational difference too. Um, so yeah.
I think I did. Is it the Gardasil one?
Yeah, it's
Yeah,
called Gardasil.
yeah, I did mine. I think I was like 14, 15 when I got it.
Perfect.
So
Yeah.
years ago.
Nice.
The doctor
Kudos to your
was
parents.
right.
Yeah. Yeah.
Well, yeah, but the doctor, recommended I get it. So it's just like, okay, whatever. I guess I
Yeah.
didn't really know what I was getting, but just kind of now kind of thinking back, it's like, now I'm glad I got it when I did.
Yeah,
Yeah.
because it's most effective before you're sexually active, and so that's why we try to get it in the little kids' arms before they hit their teenage years, just in case. So, yeah,
Wonderful, wonderful.
yeah,
All right. Well, I won't keep you any longer. I know you're
yeah,
struggling right now,
yeah.
but of course, gonna start to wind things down.
Sounds great.
But like I did last time, I like to ask my guests to share any words of wisdom with our audience. Jasmine, do you have any? I mean, you gave a lot of words of wisdom, but do you have any final words of wisdom that you'd like to share?
Hopefully, I'm not sharing the same words of wisdom over and over again. I can't remember what I shared last time, but um, I think if and maybe it's just most important to say this over and over again. If you don't feel heard by your doctor and you can, it's important to look for another doctor. It doesn't mean that doctors are going to do exactly what you want them to do, because that's not what we're supposed to do either. But we're supposed to listen and we're supposed to have a conversation and explain things. And maybe things don't happen all within one visit. We bring you back for another visit, but it's really important to find a doctor that's willing to listen to you, have a nuanced conversation with you, bring you back for another visit if it still needs more time invested. And if you don't feel like you're being heard, please just consider finding a new doctor. And I say that as a doctor who's happy to get second opinions and happy to get feedback from patients when things aren't going the way that the patient expects. So that's my words of wisdom.
Beautiful, beautiful. All right. Well, Jasmine, thank you so much for coming back
Yeah.
on Hot Topics and getting on the hot seat once again. So,
Thanks for having me.
yeah, let me get your info up there on the screen. All right. So, all right, you guys. So, Dr. Jasmine Ebott, you can follow her all over, you guys. She is on that social media. You can follow her on Facebook. Her account name is jasmine.hines, Hines.503. She's also on Instagram as JAZEBOTT. So definitely follow her on Instagram. She's also on Twitter, also known as X. It is Ebo Yasmin, so last name, then first name. And she's also on TikTok. As long as TikTok still exists, we don't know what's going to happen, but as as long as we still have it, I encourage you to follow her on TikTok. It is her first name, then last name, Jasmine Ebot. So I encourage you to follow her across her social media accounts. And if you have any questions about anything regarding to pap smears or cervical cancer or any kind of women's health issue, I encourage you to connect with her as she will answer your questions. So, is there anything else you'd like to share, Jasmine,
No.
about what you do and how? I mean, what I guess what do you do? Talk more about
Yeah, well, to finish off, if you do have cervical cancer, you will be seeing me. And that's sort of what I think can be confusing to women is I'm an oncologist, and so I take care of women with cancer of the cervix, the ovaries, the uterus, vulva, and vagina. So I hope that we don't ever meet. But if you did, then we do have lots of great treatments, and that's sort of what I do.
that. Oh, so you're there at the final stage.
Yeah, yeah.
Mm. So when people see you, is usually not a good sign.
No, yeah, but we can fix it a lot of the times if we catch it early. So yeah, yeah,
Okay. All right. Well, I mean, we need people like you. So
yeah.
No, but if anyone has any questions, can they reach out to you and they want?
Absolutely. Yeah. I've been telling people as I'm getting more and more questions, like I can't give specific medical advice, but the questions are really helpful because then I can start to build topics off of that to put on the platform so that I can answer the broad question. So questions are always helpful.
And then just another quick question. So the treatment for cervical cancer, is it the same treatment as any other
No,
cancer?
no, it depends on how advanced it is, stage one, two, three, or four. But it is usually any combination of chemotherapy, radiation, and or surgery. So it's quite intensive type of treatment. And so it's not the same for advanced cervical cancer. Early cervical cancer, maybe you will be lucky if it's really, really tiny and we'll do a cone, which is just a small procedure of removing that top half of the cervix. Yeah.
Oh, okay.
Yeah. Yeah. We can go deep into that too. But maybe not today.
Maybe not today, but I want you to rest up, heal up,
Yeah.
build that immune system back up.
Yes, I still need it too. Yeah.
Definitely, yeah.
Oh, sorry. I wanted to say this. So for naturopathic things, because people are really interested in that, there's a mushroom that has now been like approved. It's called AHCC, and I don't actually think if it stands for something, it stands for some like long fungus name that I would butcher anyways. But A as in apple, H as in Harry, C as in camel, C as in camel, and you can find them on Amazon. They're quite expensive. I think they're like $70 a bottle, is what patients have told me. And you have to take a lot at one time. But some people are looking for more like holistic ways to help kind of clear HPV. And that one has been recently approved by the CDC. Excuse me.
So
So
it's a mushroom. What is you mean
it's
like
a
a
capsule.
mushroom? Okay.
It's a capsule that is like ground up mushrooms that has been proven to kind of help women clear the HPV virus.
Oh, okay.
Yeah. So it's not nothing is foolproof, right? It's not going to work for everyone, but it has been shown to help. So when people are asking like, what can I do? That's one of the things that we've been pointing them towards, because I used to not really have anything to say, like in terms of what can you do. But this is one thing that you could do. Um,
And that's for
the
if
HPV
they
virus.
if they have the virus but they're not symptomatic.
Yeah, or anyone with the
Oh,
virus. It's like if you have the flu and you're trying to clear it. Even if you were symptomatic, like even if you had like precancerous cells, like you could still take it. It's not going to harm anything. I think even I have a few patients with cervical cancer who wanted to take it when honestly the cat's out of the bag at that point. But like there's no harm in taking it other than that it's kind of expensive. Um,
mm, right.
so
So it's
yeah,
more like it kind of keeps, I guess, prevents it from becoming full blown
it'll
cervical cancer.
Well, the hope is that it'll just help you clear that virus. And by clearing the virus, you will, hopefully not get cervical cancer. So if you're looking of a way to get rid of, think about it as like the flu and vitamin C or something when your mom tells you to take some vitamin C. If you're looking for a way to kind of clear the virus, this has been one additional tool that we have in our toolkit to help you.
So when you say clear the virus, what do you mean? Because I keep thinking like HPV is like it's not like HIV where it actually like embeds itself into the cell.
Yeah,
So
yeah.
it's sort of like the flu that it's kind of just like on the surface and it can be passed out the body. So is that what you're saying that that's what HPV is?
Yeah. And we think that people can literally clear it, like you can get rid of it, like you can get rid of the flu virus, and that it will go away completely. And then others we think sometimes goes dormant. And then if you become very immunosuppressed, like with HIV or some immunocompromising disease, then we see it come back. But we do know that people completely clear the virus, like you would get rid of the flu. Um, and then you recontract it from a new sexual partner.
Oh, interesting.
Yeah.
All right, I definitely learned something.
Yeah.
Okay.
So it's a really complicated virus. It's a really annoying virus to like explain too, because people will often even ask me like, did they get it from like XYZ partner? And we'll never know. Like you cannot blame any of the virus on any partner, because you could have gotten it from a partner eons ago and it could have been hidden and then resurfaced. Like, so there's no way to blame this virus on a pinpoint a partner, not like other sexually transmitted infections where you can be like, oh no, I got that chlamydia from you. Like I didn't have chlamydia and now I have chlamydia. It's not like that.
But
So
not like how some viruses have like a genetic component to it that you can
um
tell.
I guess it's not like how some viruses have like some like blatant symptom, like discharge, foul smelling discharge, or like
Mm,
herpes has like lesions that you see,
yeah.
and you like had the sexual encounter, you have the bumps, like you you can pinpoint when you got it. Like it's not like that. Is
Well, you said
what
yeah. Well, you said there was 9 different strains of it, so it's not like, oh, you have strain A, you have strain
right.
B, you have
We
strain C. We notice all the A's are coming from this country or something like that.
Yeah, we don't have enough lab tests, or we're not commercially available to tell you all of that. Like when the lab spits it out, they spit out like only a few. Otherwise, they just call it HPV other. Literally, we call it HPV other, and other blankets the like thousands of others. So we spit out 16, 18, 33, I think, and 35, and then everything else becomes other, and that's thousands. So I would never be able to tell you which one it is when it gets labeled HPV other.
Mm,
Yeah.
interesting.
Yeah.
Well, all that is great to know. So, so definitely get checked, ladies. All
Yeah.
right.
It hurts.
Any other fun tidbits you want to share?
There's so much. We could go so deep. It's good. We should stop there.
Okay, wonderful. All right. So yes, if there's any other, back to you, my audience. So if you have any other questions about HPV, cervical cancer, any or just any questions regarding women's health, reach out to Dr. Ebott. Her information is on the screen right now. If you're listening on a podcast, the information is in the description. So one way or another, this information is available to you. All right. Well, Jasmine, thank you again for coming back on Hot Topics.
Thank you for having me.
Awesome. Awesome. All right. You take care. I will let you rest that voice.
Thank you.
All right, you guys. That is definitely an informative episode to the ladies out there. I hope you are paying attention. So definitely take care of yourselves. All right. So, on that note, we have reached the conclusion of yet another episode of Hot Topics. So if you are still with me, thank you for sticking it out for this long. So I'm just going to just give you a quick reminder that Hot Topics is a part of my tutoring company, A Step Ahead Tutoring Services. So if you are a parent right now and your child is struggling, maybe they're just not understanding what the teacher is saying, or they're struggling to turn that assignment in, or you just that new math and you have no idea what that is about, or you're frustrated, or whatever it is, it just doesn't seem right with your child. I encourage you to connect with us. I encourage you to get a tutor from our company. Our website is www.astepaheadtutoringservices.com. We offer in person tutoring services if you happen to be in the New York City or Long Island areas, but we also offer virtual services as well. So, whether we're coming to you in person or we're coming to you online, our tutors are available, and I encourage you to connect with us, especially now. Well, depending on when you're watching it, it might be, or watching this episode, it might be testing season. So, exam season, um, report card season. So, depending on when you're watching this episode or when you're listening, something is happening. So, whatever it is, connect with us, get a tutor from us today. I will give you that website again. It is www.astepaheadtutoringservices.com. You could also find us on social media as well. We're pretty much all over the place. Just type in A Step Ahead Tutoring Services and we will pop up. Just look for the pencil logo with the gray and black tip. That is us. So, Facebook, Twitter, Instagram, YouTube, and there's a couple others. It's not coming to me, but look us up on social media and follow us. So stay in touch with us and get a tutor. If you need one, get a tutor for your child. I highly encourage it. All right. And lastly, I just want to make this last point. Let me know your thoughts about this episode. So please take a few minutes and drop a comment in the comment section below or in the comment thread. Let me know your feedback about this episode. Did you like it? Did you not like it? Did you have any additional questions? Take a few minutes right now, whether you're listening on a podcast or you're watching on a video, take a few minutes right now, drop a comment in that comment section below. Let me know your thoughts about this episode today. Give us a rating as well, depending on where you are taking in the sound of my voice. But, I definitely want to get that feedback. So take a moment right now, drop a comment below. Let me know your thoughts about this episode. Give us a rating, give us a star, whatever it is, however and whomever and whatever. Take a few minutes right now and give us your feedback on this episode today. All right, you guys, thank you again for joining me on another episode of Hot Topics. I look forward to you joining me on the next episode. Thank you guys again. And now I am signing off. Bye, guys.